Pre-IVF state-required testing. The state of California regulates that prior to starting IVF treatment, male and female clients must complete a certain test. These must be completed to within 1 year of starting your IVF treatment. These tests regulate how embryos are stored in our embryology lab. Clients that test positive or have pending lab tests will have their embryo stored separately from the rest. The following tests are the California state required tests. That is hepatitis B surface antigen, hepatitis C antibody, HIV 1 and 2, that's a human immunodeficiency virus, HTLV 1 and 2, human T lymphocytic leukemia virus, and syphilis testing. To complete the syphilis testing, patients can do RPR, VDRL, or treponema pallidum. Life IVF Center required testing. In addition to the state-mandated test, there are some additional tests Life IVF Center requires our female clients complete prior to starting IVF treatment. The following tests are chlamydia and gonorrhea. Untreated or undiagnosed chlamydia and gonorrhea can lead to pelvic inflammatory disease. This can cause inflammation and scarring that leads to infertility. It is very common for clients to be asymptomatic, meaning that they won't show symptoms, and yet they still have chlamydia and gonorrhea. This is why we require all female patients complete this test prior to starting IVF. The next two tests are rubella and varicella. We test your rubella and varicella titers to see if you're immune to these viruses. Rubella, or commonly known as German measles, and varicella, commonly known as chickenpox. Both of these viruses can cause complications in pregnancy. This means if you are not immune and you come into contact with the viruses and are pregnant, you can have problems such as miscarriage, stillbirth, or deformities. Furthermore, the vaccine for these tests is a live vaccine, meaning that we have to wait at least 30 days before doing an embryo transfer if you receive the vaccination. Even if you've had these diseases in childhood, it still can mean you're not immune. That's why it becomes very important to test for these titer levels. This ensures immunity. A CBC, that is your complete blood cell count. This tests for things such as your white blood cell count, red blood cell count, hemoglobin, hematocrit, among other things. The main purpose of this test is to make sure you have no anemia or a current infection. We sometimes get your blood type. This is commonly referred to as ABO-RH typing. Mainly we're looking at the RH typing, because if you are RH negative and you have a possibility of having an RH positive fetus, you will need the RhoGAM shot. This prevents your body from forming antibodies that could cause complications in future pregnancies. Life IVF Center also requires that patients complete an HSG or SIS. Life IVF Center will accept either of these tests. The HSG, or the hysterosalpingogram, is done with dye and X-ray. The SIS, or the saline infusion sonogram, is done with saline and ultrasound. Both of these tests test your uterine cavity by injecting dye or saline into the uterine cavity to visualize it better. We test for any imperfections, such as a polyp or small fibroid that could prevent an embryo from implanting. And Life IVF Center also requires patients complete their pap smear. In addition, Life IVF Center requires that women over 40 complete a mammogram. It is extremely important to do a mammogram prior to starting IVF treatment, especially in this age group. This age group is especially at risk for breast cancer. Exposure to hormones during IVF treatment can accelerate breast cancer. Therefore, we want to make sure our patients are healthy prior to starting IVF treatment. Males are required to complete an additional test as well. The additional test males are required to complete is the semen analysis. Life IVF Center recommended testing. In addition to the required testing, Life IVF Center recommends that our female patients complete some additional tests. The following tests help ensure patients' health and look for additional causes of infertility. These are recommendations and not required, but it is strongly encouraged by Life IVF Center that all female clients complete these tests. The following tests are TSH, thyroid stimulating hormone. This test checks the function of your thyroid level. AMH, anti-Müllerian hormone, examines your ovarian reserve and ovarian function. Prolactin, vitamin D, and carrier screening. Carrier screening is a genetic test that tests to see if you're a carrier of any genetic diseases. These are diseases that could potentially be passed on to your offspring. Specifically, Life IVF Center recommends that you complete cystic fibrosis and Fragile X prior to starting IVF treatment.